Struggling to memorize muscles and bones? You're not alone. But what if I told you there's an easier way? With powerful mnemonics and visual tricks, you'll master musculoskeletal anatomy faster than ever. Stay tuned. Let's make studying simple. First, we discuss the hands. The mnemonic pad and dab helps remember finger movements. Pad, palmar interosseous adduct, which adduct the fingers, and dab, dorsal interosseous abduct, which abduct the fingers. To recall extrinsic hand muscles, use Extrinsics extend. These muscles start in the forearm, insert into the hand, and control large movements like flexion and extension. Flexor digitorum profundus flexes the fingers at distal joints. Flexor digitorum superficialis flexes the fingers at intermediate joints. Extensor digitorum extends the fingers. Extensor pollicis longus extends the thumb. Intrinsics fine-tune assists in remembering that intrinsic hand muscles handle small, precise movements within the hand. Lumbricals flex the fingers at the metacarpophalangeal (MCP) joints and extend them at the interphalangeal (IP) joints. Palmar interosseous adduct the fingers. Dorsal interosseous abduct the fingers. Thenar muscles control thumb movements. The OAF mnemonic covers the thenar muscles of the thumb. Opponens pollicis, abductor pollicis brevis, flexor pollicis brevis. Now we move on to forearms. Pass, fail, outlines the forearm anterior muscles from lateral to medial. Pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris. To recall the posterior forearm muscles, use big chocolate chips, double-dip cherries, brachioradialis, carpi radialis longus, carpi radialis brevis, digitorum, digiti minimi, carpi ulnaris. Moving on to oral. The mnemonic to Zanzibar by motor car helps recall cranial nerve 7 branches: temporal, zygomatic, buccal, marginal mandibular, cervical. Paris Saint-Germain's hour assists in remembering tongue muscles: palatoglossus, styloglossus, genioglossus, hyoglossus. These muscles are responsible for moving the tongue in different directions, including elevation, retraction, depression, and protrusion. The Sanka mnemonic covers the posterior triangle of the neck: sternocleidomastoid, apex, nerve, accessory, clavicle, anterior trapezius. And now, we're on to shoulders. To recall rotator cuff muscles, use sits, supraspinatus, infraspinatus, teres minor, subscapularis. AIM outlines deltoid muscle functions: anterior, flexion; intermediate, abduction; middle, extension or rotation. Now, what is the mnemonic for musculoskeletal assessment? The IPASS mnemonic helps guide musculoskeletal assessment steps: inspection, palpation, active range of motion, passive range of motion, strength, special tests. Lastly, what's the mnemonic for the 8 carpal bones? So, long to pinky, here comes the thumb, assists in remembering the carpal bones: scaphoid, lunate, triquetrum, pisiform, hamate, capitate, trapezoid, trapezius. Use these mnemonics to power up your learning and make studying effortless. For more study resources, visit LatrinaWaldenExamSolutions.com. Don't forget to like, share, and subscribe for more tips and tricks.